Hey, how's it going? My name is Jeremiah Nickel, aka JT Nickel on Reddit, at ProDJKC on Twitter. Uh, I got to tell a little personal story. I've been sick for the last week with a cold, sinus thing, all the typical stuff that you see this time of year, especially if you work in a school building. And this isn't about me and my poor me situation with getting my medicines prescriptions filled. Uh, but I just had my eyes opened up as to a larger problem. It seems like getting people what they need as far as healthcare goes. Um, no country is perfect at this, of course, and we want to keep people safe and keep our drug addicts safe from manipulating the system. So I understand a lot of the barriers that are out there. So, and I want to know if you think there's ways in the pharmaceuticals world that blockchain, such as Ethereum, a smart contract system, could help solve some of the issues that happened to me yesterday. I go to the doctor. I'm there at 7:30 in the morning. I see my physician. She put in a prescription for what amounts to basically penicillin in a pill form with like some Mucinex or something. So we're talking about nearly over-the-counter antibiotics. In some countries, they would be over-the-counter. And so she puts in the prescription to CVS Pharmacy. Now I'm going to name some companies here: CVS, Walgreens, Blue Cross Blue Shield of Kansas. And then basically the whole HIPAA, encrypted medical information history stuff. So all this stuff kind of plays into the story. I drink coffee, pardon me. And she puts in the information to put my prescriptions in to CVS Pharmacy. And then CVS calls me not too long after that and says, Mr. Nickel, we need to let you know that CVS is not covered by Blue Cross Blue Shield. This blew me away. We are talking about the Walmart of the insurance world not having a contract with the Target of the pharmacy world in America, right? When you think pharmacies in America, at least for me, I think Walgreens and CVS. And the funny thing is they're always across the street from each other, no matter where you go. It seems like if a Walgreens is going in, a CVS is going in right across the street. It's true for where I live. So I said, well, okay, what do I do? Now, this is me as an ignorant patient, and let me stress this. I'm a healthy person. My family's in 5 different school buildings. We're a pretty healthy family. Yet we spend thousands and thousands and thousands of dollars on healthcare stuff, so we never have to use it, right? And so we don't understand all these different hoops. So long story short, the person at CVS says, well, you'll need to have Walgreens call in to our pharmacy to have it faxed over to Walgreens. Faxed. I had no idea we still use this thing called a fax. Okay, I mean that blew me away. So I called Walgreens. I said, okay, we'll get it over there. Now it'll take about 45 minutes for the fax to go through. She says 45 minutes because we're busy, and then of course CVS said that they were busy and backed up, but they would get it as soon as they could. That was at 9 a.m. So I called back at noon. And I went through the automated system. No, we don't have record of your prescription at Walgreens. So then I wait and I know they're busy, and I get it. They're busy. I'm very easygoing. And, but I needed to talk to a pharmacist or somebody to help. They get on the phone and they say, we don't have anything in our records yet. So they must still be trying to fax over. I said, well, we did this at 9 o'clock, and I was ready to leave work to go get it at noon. They didn't have it. So I'm like, okay, I'll give it a few more hours. At 4 o'clock, I just decided to go straight to CVS and asked them, do you have my prescription over there? And the lady at the front counter says, I don't see anything in our system. Now, I learned later there's two counters, the front counter and the back counter where the pharmacist is. And the reason why I know that is because at 4 o'clock, I gave up at CVS and I just went over to Walgreens and I asked them, and the Walgreens technician says, now mind you, they're across the street. I could throw a baseball into each other's parking lot. The Walgreens tech says, we still don't have anything in our system. It must be in their pharmacist system in the back system at CVS, but we can't handshake with that and see that information yet. And the pharmacist, and this blew me away, she says, I have 12, if you want to wait a minute, I have 12 orders to get through but I can't see any of them until I open them up and work through them. But if you want to wait a little bit, I can see if your order is in there. I waited a little bit. It's not in there. They called CVS again. At this time, I said, okay, I'll check back later. Because I knew it was still going to be another 45 minutes for the fax to go through, okay? Plus, both are busy, and the Walgreens said, I'm sure, sorry. Walgreens texted, or this pharmacist said it'll still take a little bit of time because we got all these other ones. I'm like, I know, I understand. And so I go home. 7:45. Now, mind you, the first interaction, this was supposed to take place at 9 a.m., okay? Then 7:45 p.m. rolls around. I go back to Walgreens. They still didn't have it yet. They had to call back to CVS. CVS says, that's my doorbell. It sounds like a rooster. CVS says, we don't have it in yet. Or no, they said, it must have got lost. That's it. It must have got lost in the transmission of the fax. It goes back again to this fax system that they still use. And so they rushed it through. I was the last person in Walgreens at the pharmacy. They were closing the doors down. Almost 12 hours later from the original time it was supposed to get transferred. Again, this is not a woe is me. I'm just really glad I'm not an asthmatic person, a person with diabetes, or somebody that, I don't know, has a stent or a colostomy bag or something much more severe than a sniffle. And to this point, I think it kind of goes back to the doctor's office. How come at the doctor's office, when they're looking at private medical records, they can keep all that encrypted, and they can keep the companies that do the software and everything. How come these top tier companies like Blue Cross Blue Shield and CVS don't just flag off in their system if my card comes back and it says that CVS doesn't have a contract with them? Okay. I don't understand why it doesn't just start there, or with all the pharmacy reps that are out there that shill all these drugs to these doctors to pump to their patients. Is there not a flyer that they hand out that says, hey, Blue Cross Blue Shield works at these pharmacies in your area, Aetna works for these pharmacies in your area? I mean, is there no communication back to the doctor's office about these things? And it makes me wonder, with all the fax transmission problems going from store to store the way that they have to, how many other people in a given day have to sit through this process? I just feel really bad for people who have extremely, a really bad situation, such as lack of mobility, the elderly, the young, right? The people who have limited resources. Otherwise, thank God I have a car. If I had to sit at Walgreens for 12 hours waiting on what amounts to be $1 worth of penicillin, even though I'm spending, or my family, our family probably spends out of pocket $15,000 a year in health insurance, and to have this kind of thing happen, it's interesting to me. I don't know what your thoughts are. I don't know if blockchain could solve this. The only thing I was thinking about with blockchain is the peer-to-peer, end-to-end encryption. What if you actually just sent I would think that there would be some ways that smart contracts could help keep track of who handshakes with who and how they handshake. There's a way to keep information private yet still trustless. going from party to party. So I would think there's some way to design a system that would go between Walgreens and CVS and the different insurance companies and the doctor's office and the patient, bringing all kind of like 5 of these things together. So when a situation comes up, it could be transferred. You can't fake that transaction too. So for people who abuse opioids, let me look at my situation yesterday. I bet somebody that has an addiction to painkillers, I feel so sorry for those people, but they'll find a way to get things done. I just don't know all the loopholes that they do. Now, you can always count on a drug addict to basically have the equivalent degree of a rocket surgeon when it comes to acquiring their fix. You know, I just need some Flonase, man. You know, like anyway. I hope everybody's doing good. Thanks for letting me hear my rant. I will be tweeting this out to Walgreens, KC, KBS, Blue Cross Blue Shield or whatever of Kansas, and CVS. I'm not mad. It's just kind of comical after you look back on the day that I had yesterday. I'm just trying to get to work, man, without taking days off. So anyway, hats off. All right. It's 2020. Here we are. Cheers. It's 2020 and we're dealing with fax machines. That's the other mind blow. Cheers and big hugs from Kansas City.